Good afternoon. I'm Dr. Deuk, broadcasting live spine surgery from Deuk Spine Institute. Our patient travels from New York to Miami to Deuk Spine, and she has pain from her discs, which we just repaired. She also has back pain coming from the two SI joints, sacroiliac joints. It's where your tailbone, the sacrum, connects to your iliac bone. It's just medial to the gluteus maximus muscles. These joints are extremely tender and painful on exam. That tells you she has sacroiliac joint pain. Treatments include shots and fusion, and now the Deuk plasma rhizotomy as well as RFA. None of those treatments work except the one we're about to do. It's called the Deuk plasma rhizotomy. We're going to go in and we're going to destroy 5 pain nerves to the joint. So let's bring our fluoro in. We're going to localize where we're going to do our skin incision, and then we're going to make a 4mm skin incision. It's a Band-Aid incision. She's asleep, so she's comfortable, and then we're going to use our probe to basically destroy and burn the pain nerves to the joint. So I would say, let's see, shot right about, shot right about there, right in the middle. We're going to make a tiny little incision, and then I'm going to use my probe to go in and basically burn these pain nerves. And not just burn them, but transect them. What is transection? Transection means to cut. And why are we cutting a nerve? Because these nerves are pain nerves. That's all they do is carry pain signals from the brain, from the joint up to the brain. The first nerve is located at the top right there, just above my probe. Shot. All right, so we're a little bit too low near the foramen. We want to go further up to get to that first nerve. I'm using the X-ray machine to guide me. Jordan, show us our target up there for the audience to see. Shot. Yeah, right where the tip is. You guys see where the tip is?
Yes, we do.
That's the perfect target. Now I got to make sure I'm on bone. I'm feeling. Shot. I am. Don't want to slip above that little notch there. I don't feel it discharging. Give me 1 second. We're set at 40. Shot. Let's get back to where we were. Pretty darn close. Shot. Shot. I'm going to move around a little bit just to make sure we're going to get this pain nerve. There we go. I just felt it, actually. The pain nerve, believe it or not, that one was humongous. It was absolutely huge. I went through it though. So that should eliminate a lot of the pain to the joint. Shot. You can actually feel these pain nerves. They're real nerves. They're bouncy if they're big. They're bouncy and you can feel them. And the key is to transect that pain nerve, cut right through it so that it disrupts the pain signals going to the brain. There's 5 of them. We've already done 1 shot. I'm going to move down a little bit now. You could see the medial iliac wing. Shot. So I'm going to come down on this right side here. This part of the joint is very deep, very anterior. So far, everything's going well. Henry, can you show the audience the video on the SI joint and how SI joints became painful and how we use this procedure to destroy the pain nerves that are responsible for the pain? Shot?
Of course. Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
I think we're done here. Okay, we are finished with the right side. Let me show you what we did here. Pull out for a sec, Jordan. Look at this. Look at that incision. It's 4 millimeters. That's it. We did one incision, 4 millimeters. All right. We've treated the right SI joint. They basically, do you have a marker? Yes, sir. Yeah. There were basically these 5 nerves that came over to the joint, and I basically cut all 5. It's called a rhizotomy, and it's so easy. I honestly don't know why nobody else thought of this before me, but I don't even, I'm a neurosurgeon, right? So we know how to protect nerves, but we also know how they can be harmed. And when my partner told me, "What are you doing with this RFA?" He said, "We're trying to destroy the pain nerve." I said, "Well, why doesn't it work?" He goes, "I don't know. It just doesn't work. The patients have to come back all the time and get it done again." And that's everywhere in the world is that way. And I said, "Well, it's very easy to kill a nerve. I'm a neurosurgeon. I know how to kill a nerve." So I brought this technology, and now we destroy the pain nerve. It's just a pain nerve. That's all it is. It's not any other kind of nerve. It's just pain. And so you destroy it, and the pain goes away. We're going to do the left side now. And I know we have a question.
Yes.
Go ahead.
This question is coming from Faisal on Facebook. Asking, "Doctor, what causes pain that a patient needs a rhizotomy? As I know from you, the disc tear causes inflammation. Regarding the facet joint issues, is that again inflammation?"
Yes, Faisal, you are correct. The rhizotomy, a rhizotomy is a procedure where you destroy a pain nerve. The question is, where does that pain nerve go to? And the answer is, it goes to, in the case of a rhizotomy, it goes to a arthritic joint. Now, there's lots of arthritic joints in the human body, right? Knees, hips, shoulders, facet joints, sacroiliac joint. Those are the main joints right there. But also thumbs can become full of arthritis pain, and elbows, wrists, fingers. All of those painful joints are painful because of arthritis. This treatment, the Deuk plasma rhizotomy, can cure all joint pain. So the rhizotomy is done where there's a painful joint. That's really what it comes down to. Once again, a big pain nerve on this side. This is the L5 dorsal ramus. I'm going to start out laterally and just make sure. I'm going to go up a little bit. I could feel a lot of inflammation in the joint too. She is young, and her joint still has joint fluid. You can see the joint. Show us the joint, Jordan. Do you guys see the joint there?
Yes, we do.
All right. Well, that joint is what's full of arthritis and inflammation. And look how it's separated. See the gap? Go up a little bit. No. There. Look at the widening of that joint. You see the cortical rims, the
Yes, we
dark
do.
part? There's swelling in that joint. There's swelling from inflammation. Shot. We're right in the exact perfect place. Shot. You always want to be away from the nerve roots in the foramen. So what I'm talking about, show us, shot. All right, see the tip? Go up north to that tip. He's going to show you where you want to stay away from. Keep going. You never want to go past that line right there. Okay, never. Up above that is where the real nerves are that go down your legs. So we want to stay away from that area. And we do. We stay away. Shot? Yeah, I never go above that line. And there's other nerves you want to avoid as well. Shot? All right, I'm heading out laterally. You could see the medial projection of the iliac. We're almost done. We got 1 minute left. Are there any other questions?
At this moment, no current questions, but we do have a comment
Sure.
from Indigenous American on YouTube
Yep.
saying, that was so quick. Nice work.
Thank you. Thank you. I got an amazing team here to support me, and I couldn't do any of this without my team. They're the best. We're almost done. Sean? Shot?
Oh, we just got a... Oh, yeah, this is a question coming from, forgive me if I'm pronouncing this wrong, Hallcat on YouTube, asking, is there a connection between lower back pain due to a disc bulge and weakness in the groin muscles, burning/tingling sensation under the belly, below the navel, each time the lower back hurts?
No, there's no real connection except that sounds like a hernia, an umbilical hernia, and you should have that checked out by your doctor. Burning in that area is typically from a hernia, in my experience, but no, it's not connected to your back pain. Shot. All right. The problem with taking the pictures, I have to release the probe and then it looks like I'm somewhere different than I actually am. But, all right, just about done, 10 seconds. So far, it's going really well for her.
We have just one more question
Uh-huh.
coming
sure.
from Maz187 Links on YouTube,
Hi there, Matt.
asking, I was curious if you take TRICARE for insurance. I am dealing with some major back pain and getting my MRI tomorrow.
Yes, we do take TRICARE. However, your TRICARE will cover your consultation, but it will not cover a lot of our treatments. The reason TRICARE doesn't cover it is the military doesn't want to spend money on patients. They have this company called Humana that manages TRICARE benefits, and Humana's job is to deny. And so any type of treatments like these that work, they don't want people finding out they work and then wanting it, because it's going to cost Humana and TRICARE money. So the whole system is broken, especially the insurance. They want only treatments that don't work or don't last to be available to their beneficiaries. We have a lot of TRICARE patients, a lot of military patients that come here, but many of them have to pay out of pocket. And you can take your bill and submit it to TRICARE and see if they'll reimburse you. We've actually had some of our TRICARE patients do that, where they've taken their bill after they paid it and gotten their surgery, and they've submitted it to TRICARE and they've had TRICARE pay it. So that's what I would tell you. But we cannot get TRICARE and Humana to cover all these newer technologies that work, because they don't want to spend the money.
And that is it for questions.
All right, well, we're done, and I appreciate everybody being here, and the surgery went very well. We'll be back shortly with a 2-level thoracic, DLDR, lumbar, and facets.